This marks the 5th year in a row that the majority of our colleagues have supported ending this arbitrary insurance limit on the treatment of a whole category of what this poster makes clear are neurological, physical diseases. In the last 5 years, more than 150,000 Americans have lost their lives to suicide, 90,000 of them with serious mental illness. In the last 5 years, American employers have lost over $150 billion of productivity to depression alone. That's more than the GDP of 28 different states during the same period. In those 5 years, well over 60,000 American families have been broken apart by the absence of insurance, because the only way for parents to get treatment for their children is to turn the custody of those children over to the state. And in those 5 years, Mr. Chairman, the leadership of this House and the committees of jurisdiction have yet to even give this bill an up and down vote. We need a vote on the Paul Wellstone Equity Act for mental health insurance. Thank you.
For what gentleman from Rhode Island? Gentleman is recognized for 5 minutes.
First, let me commend the chairman and the ranking member for their work on this bill. Today, I rise to bring attention to a very critical issue in this issue, and that is how to provide evidence-based treatment for prisoners with mental illness and substance abuse disorders. At the time of arrest, nearly 74% of those at the time of arrest test positive for drugs and alcohol at the time of arrest. The disease of alcoholism and addiction is obviously a very important one in our justice system. And hence, if we're going to reduce recidivism rates and reduce the revolving door of people going in and out of prison, we must tackle this issue of trying to reduce the stigma and the treatment and access to treatment of those with alcoholism and addiction. A study by the National Institutes for the Drug Abuse has said that prison-based substance abuse treatment programs combined with aftercare reduces recidivism. Those who have not received these programs have recidivism rates up to 75% of the time. Those who have had treatment have recidivism rates under 27% of the time. Okay? 75% without treatment, 27% with treatment recidivist. So the fact of the matter is, we can make enormous difference in helping to reduce not only the lives lost, but also the cost to our prison system. We're going to add $90 million in this budget bill for new prison construction. How many people out there as taxpayers want to pay for new prison construction when over half the people in prison today are there for simple possession of drugs and alcohol? I'd like to ask the chairman of the committee to engage in a colloquy and first commend him for increasing the amount for the drug courts over 300% in this budget, recognizing the importance of reducing recidivism and keeping people out of the prison system, and ask him whether he'd work with me to make sure that we tie in the National Institutes of Drug Addiction, obviously the Substance Abuse and Mental Health Services Administration, and of course HHS, to help us address this overall issue that does not just lie in the justice system, but rather lies around an interagency approach to this subject.
Gentleman from Rhode Island is recognized for 1 minute and 15 seconds.
I thank the gentleman from North Carolina for his work on this issue. On June 13th, Rhode Island and Providence lost Mike Day of a heart attack just after he'd returned from a fire to the fire station. He's the son of a firefighter, and he's one of 4 brothers who all became Providence firefighters. He was passionate about helping save people's lives and helping to serve people. Who has he left behind? He's left his wife of 22 years behind, Cynthia, as well as 4 children, Mike Jr., Amanda, Brianne, and Stephanie. The Hometown Heroes Act has been signed by the President 3 years ago. Where is the support for these families who put their lives on the line to save our lives in our communities? The delay out there from the Department of Justice means that these benefit applications of people like Mike Day are waiting, collecting dust in the Department of Justice. This is inexcusable. Mr. Speaker, I believe our public safety officers need to know that if they lay down their lives for us,
that we're going to be there to back their families up and make sure those families are supported. The hardship of these families shouldn't wait on the Department of Justice, and neither should we in Congress wait for the Department of Justice. I urge passage of Medicaid budget. She would have to live in the right state in order to get the supportive services she needed, because this Republican Congress has cut funding for the developmentally disabled in this country. The very people who are treating the most vulnerable people in our society, the handicapped, the people who are living in group homes, in institutions, those people are being paid the least. They're being paid the minimum wage. They're taking care of God's children. God's children. And yet this majority says they want to make sure they stand up for God. Where is their religiosity when it comes to standing up for the children of God? Where is their sense of justice when it comes to making sure that we treat others with the dignity and respect that God would have us treat one another with? This is a joke, Mr. Speaker, that this majority would talk about God and yet not even work to raise the wages of the very people that are taking care of the children of God. I yield back the balance of my time.
Gentleman from Georgia.